What's one word or phrase that we should stop using at the workplace?
Pushback.
Pushback.
I
Like I'm going to
hate
push
pushback.
back on what you
That
just
is a
said?
bad idea. We're going to push back on that idea. We need to push back. And I'm like, oh no.
Lynn Hennessian is the Chief Health Strategist for Edelman, and you focus on stakeholder engagement in good times and bad, according to your LinkedIn
That's right.
profile. So are we in good times or bad times right now?
You know, it's always a mix of both.
Okay.
And you know, the good times, and I say this from like a industry agnostic perspective, there's more and more ways to directly engage with stakeholders.
Okay.
The bad times are, and this is one thing that healthcare is fine. So what's the key feature about healthcare? It's regulated. So there's certain things you can and can't say. There's certain ways that you can engage. You have to maintain privacy and whatnot with data. We aren't keeping up with other industries.
Really?
Like on consumer products, I can go online and bitch about a product and their consumer helpline will get back to me.
And I do it all the time.
I know. Well, occasionally I do. And you know what? You know what really gets action? Sending a note to a CEO. That's been very powerful.
Yeah.
over
Have you
years.
done that?
Yeah.
And it worked?
And it's changed my perception of brands. Oh yeah.
The way they respond?
Yeah.
Sure.
Like loyalty goes up like you can't believe. But a lot of healthcare is still not quite able to
Right.
have that kind of conversation.
Right.
And so when we're consumers and we're patients or we're loved ones, you know, I can get much more information about the car I'm trying to buy than the procedure I'm trying to guide my husband on.
Right.
And that is a tension point. We've got to catch up.
That's really, I didn't even think about it that way. That is pretty crazy. Well, we should say Edelman, for those who don't know, is a PR and communications
We
company.
call
a little bit more
ourselves
than a startup.
a little bit more. Whether we
Okay.
started up here
Okay.
in Chicago, and we're the largest global company. And of all things, we founded when focusing just on healthcare, we founded our dedicated healthcare practice in 1984.
Okay.
So
You've
back
been at
in
it for a few years.
For a few years, we've been on the case,
Yeah.
working with companies and organizations and communities to try and move health forward.
Okay. And there's something that Edelman is really known for, the trust barometer, right? And we're talking about how to engage people in a world where trust is sort of eroding. That was kind of what you and I focused on. So especially in healthcare. So I guess, what does the trust barometer tell us about healthcare right now? Healthcare is not really known for getting the best bang for your buck.
Well, that's a great suggestion, particularly in this country. Couple things. You know, when the pandemic hit, all of a sudden, industries that had not been as trusted, all of a sudden went right up the chart. And we did a lot of research on this. Healthcare and food and beverage went right up the chart because all of a sudden these
in terms of increasing trust?
Increasing trust, which is an expectation that industry is going to do the right thing.
Okay.
And one of the things that's been remarkable about trust is if you don't have trust in healthcare, you're less likely to follow what your doctor says.
Right.
So you may have access to healthcare, and the doctor may make a recommendation. If you have low trust, and it's not, you know, it's in the health system, it's in this whole sort of ball of the ecosystem of healthcare, you're more likely to turn to an influencer on TikTok than to follow the recommendation of your doctor.
Yeah, I know a lot of people who do that.
And that's not a great idea. The other is, and this is if you got to take a look at
that in financial advice either.
Well, and where do the two intersect in the U.S.? Money and health closely locked to
They're connected.
things. But if you take a look at particularly the current rising generation of digital natives, when we did a study not quite a year ago, almost half of them said that if they do their own research, they can know as much about a health issue as a doctor. So you have this sort of crisis in confidence and authority, and so it's when you realize that people are willing to make decisions and take actions that may not be in their best personal interest. We have to figure out why, and we have to figure out how to solve it.
Is there something to do with the fact that, you know, just information is so readily available in a way that it never has been before, and so we think maybe we can sort of become our own little doctor by just watching a couple YouTube videos and then
Well, there is a lot of confidence in the in the young folks that can happen, because we're used to information on demand, and we can't get that as much from our healthcare sources, and we have to find a way to become better critical consumers of information that's served up to us.
Yeah. Well, and, Edelman does a lot of things, and you're involved with, and you are, a chief strategist can mean a lot of things to a lot of people. So help me understand, what are you helping your clients accomplish, sort of before we get into the bigger topic, I guess?
Absolutely. So I note that this is my first PR job. I've had it now for 27 years, but I got interested in healthcare. I did academic research. We did research in communities in Chicago around things like teen pregnancy and pregnancy prevention. Then I worked for a professional medical society and learned a lot about how doctors learn and engage and take care of their patients. And then I had the great fortune of coming to Edelman. And clients come to us to help sometimes identify the problem they're trying to solve. Like, how do I get people to understand the importance of a particular condition so that they can go see the right doctor.
Right.
But in some cases, we're doing things like raising public awareness, individual audience at a time, about the importance of things like getting a comprehensive annual eye exam.
Right.
And so it really is, what's that lead business challenge that we can be solving for our clients? A lot of our work is focused on building corporate and brand trust. Mm-hmm. And we really see that as a fundamental, urgent priority for businesses, because it makes a difference.
Right.
If you're trusted, you get some level of loyalty. And in healthcare, the recipe for trust is it's not that hard when you're talking to a general public.
Okay.
But it's really, really hard if you're a doctor or a nurse or a clinical team that's pressured to do more in less time,
mm-hmm. Sure.
that may be a little bit burned out still from the pandemic. And they want to be treated like consumers. They don't want to have to wait. They want to have enough time to talk with their care team, to understand what they're being told, to understand that the research that's behind the recommendation is coming from someone like themselves. Mm-hmm. And so it's really bringing sort of the specialty that you do all the time in terms of targeting and storytelling and engaging,
right,
to a particular industry when you've got this very personal dimension. When someone is diagnosed with a new condition, that sort of challenges who you think you are.
Right.
When you maybe someone is hitting their middle ages, and they may have been a great sports person as a child, and now all of a sudden they're being put on a blood pressure lowering medication, and all of a sudden I'm like, oh, I'm used to be immortal and now I'm not.
Yeah, it's an identity crisis almost. So I guess to kind of there's a lot at play here, right, when it comes to navigating this for your clients,
right,
and for the healthcare industry. We sort of talked about like the level of information we have access to, but what are like the 2 or 3 sort of parts of this challenge, I guess? Could you sort of summarize that in terms of like the landscape of what we're dealing with here? We talked about like generations and what's going on.
So the one is, it's not one size fits all. The polarization in the U.S. as it affects how we think about healthcare is really problematic. And people who and so you have to sort of think about.
Are we talking about politics?
No, we're talking about healthcare.
Okay.
We're talking about like things like vaccines. We're talking about reproductive women's healthcare, and people.
But the polarization part of it.
The polarization of it. People believe, and in fact, the number 2 societal issue in the U.S. that affects people from being able to take care of their health is polarization of information, because they don't know who to turn to or who to trust.
Gotcha. Okay.
And so that is really, for scientists and clinicians whose careers have been on proving things, all of a sudden the science proof is being challenged by someone's individual beliefs.
Okay.
So you have to. So one of the things that we look at is, who would a trusted source be for someone who has confidence in the health system versus someone who doesn't? And so it's a different person that you would turn to.
Right.
Friends and family are very influential.
Right.
And particularly influential for people who don't trust the healthcare system. So knowing that you're going to be talking to different tribes, different different people are coming in with different beliefs. That's one of the challenges that we overcome, because that is, we need to really tailor our engagement with those folks. The other piece is information changes pretty quickly. It's a great age for innovation in medicine. Mm-hmm. But then
you're even talking about the truthful information.
I'm talking about science, yeah. Science and truthful information and proven stuff.
That stuff can change.
Proven stuff quickly. Can change. It can. It changed a lot during the pandemic. And so how do you help people to prepare for that?
Yeah.
And a great example is some remarkable gene therapies that are being studied right now, and some are coming to market that are helping people who've had really challenging conditions with one treatment. They may be remarkably transformed and helped. Yeah. And that's really exciting, but not if people don't trust healthcare.
Right.
So you can't reach them.
Yeah.
So we have to really sort of think about how do we find our audiences and engage them, earn attention, good storytelling like you do. And the other is, I think the last piece is it's just so complicated.
It really does seem complicated, because I feel like you're a subject matter expert. Right. I feel like I could talk to you all day about this. I'm going to learn a lot, but I'm going to still be like, gosh, there's just a lot I don't know how to even know where you start.
Well, and I think it's hard for business owners, business owners who are faced with the decisions they need to make about providing health care to their employees and to their workforce. And it's complicated. I mean, is it I have wonderful health benefits. Is it because of Blue Cross Blue Shield? Is it because of the place where I get my health care? Is it because of something going on at the pharmacy? I mean, you sometimes don't know where to turn and when to turn. And I think that's a real challenge. So I think those are sort of the three things that I think about a lot.
Yeah. Well, I can relate to a little bit of both sides. I mean, I'm sure a lot of people can, but I personally have had experiences at doctors where I was on a streak where I wasn't having very good experiences.
Right.
And I started to have my own concept of what it is to be, what the healthcare system is, and what my experience is going to be like. Okay. And but then, of course, I have family who've really relied on it, to survive and to thrive. And so, it is hard, because it's also based on your own experience too.
Right.
Right.
Right. And this is we had the opportunity to talk about your important idea that people should be putting down their devices.
Right.
This is a place where you need to find that right mix of technology but relationship. It's really important to have a relationship with a healthcare team and a facility. I have this great story. We have one child, otherwise healthy but opinionated son, and
how old?
He's 22 now.
Okay. Oh, perfect.
Yeah, perfect age for him to just. But I had worked for the American Academy of Pediatrics when I was pregnant. I, was still relying on that information. I'd been at the academy for 8 years, then I was at Edelman, had a child, and so I knew, because I had been immersed in the world.
You've been in it, yeah.
And so when we needed to meet a pediatrician, I had some referrals and went and talked to them. And when you're a parent for the first time, they look at you because you've never done it before. And we had a wonderful, wonderful pediatrician, and I came in after 4 days. He said, "How's it going?" I said, "Oh, he slept 6 hours," and he was horrified that he may not have been, because I was breastfeeding at the time, may not have gotten a feeding. And then he went out and weighed Isaac, and then brings him back and goes, "Oh, he gained weight." I'm like, so now we have confidence,
right?
Because I've proven I can,
right,
do, and that's and it's really, really hard for clinical teams to understand what's going on in your life and all the things that affect your health.
Sure, yeah.
When someone who may have asthma who's going home to an apartment that has black mold, right? So you may have there may be things that are beyond what you can see and experience that are making a big difference in the lives of the people you're taking care of.
Yeah, for sure. So help me connect the dots, because you gave some big picture, like these are the things we kind of need to be doing here, understanding at least, to be able to help shape trust a little bit here, right? Or to promote trust. I guess, do you have an example of whether it's a client example or something that you're working on, that you're doing to help connect the dots between, okay, we need to accomplish this big challenge,
Yeah.
And this is what we're doing on the ground here, so to speak.
Sure. So, so I had the great opportunity to present to a big room full of students who are members of PRSSA last week, and some of them didn't know
and
that.
For the folks that don't know, I know.
It is the Public Relations Student Society Association.
Okay, I knew that. I knew that.
Yeah. So it's the professional association that when kids are in college and they're choosing a comms career, public relations,
right.
They may be involved. And so there's a lot of energy among these mostly college-aged kids. Many of them didn't know you could just sort of dedicate yourself to health. So I feel like I should need to be representing that. But the other piece of it is we need to start with sort of the analytic side of our brains more than our emotional side of the brain.
That's tough.
It's really hard.
We're pretty emotional people, even though we think we're not all the time.
Yeah. So we got to get both sides of the brain working.
Got it.
And so you got to start with the research and understand, what's the business problem we're trying to solve, and what are the hurdles.
Okay.
And where are allies to help us.
Okay.
And that's a real deliberate effort of saying what are the stakeholders we need to reach, and how can we move them? How can we motivate them? How can we engage with them?
And stakeholders could be like policymakers.
Could be policymakers. They could be regulators.
Okay.
They could be patient groups.
Yep.
They could be doctors. They could be investors if you're working for a company that's a for-profit company.
Yeah.
So each one of those groups, and there may be many others depending on the situation, has an expectation. You need to understand that and think about how we address it. We do a lot of work, for example, with some companies on helping to tell their science story, because all of those stakeholders want to understand what you're doing, and we're in a world where transparency is super important.
Sure. Yeah.
And so bringing people along in understanding, what is an electric car? Why is this good for us?
Right.
But what is a gene therapy? Why is this going to be beneficial for us? How do we think about it? How do we pay for it? Who's the right person to be getting it? So these are all, related but subtly different questions.
Yeah.
And so we start with that, and then we determine what our really our value proposition is. Right. In relation to each of those stakeholders, and make sure that we are bringing them along in our journey so that they can understand and appreciate and hopefully value, an innovation as much as our clients do.
This sounds like, kind of taking it back into sort of brand and marketing world here. This is like a version of a brand campaign, so to speak, but yet there's a political campaign almost side of it where you're relationship building too, right?
Oh,
where
yeah.
It's a little bit more complex than let's advertise this and put some money behind it and hope that enough people see it.
Right. And it's really because there's in almost everything there's a trade-off. Am I going to buy this brand of ketchup or that brand of ketchup?
Right.
In this case, it's how do I prioritize something, and what does it mean to the downstream communities that I'm either dedicated to or I'm part of. And so if I'm there are certain policy issues like getting some protective tools in schools, like getting epinephrine pens available in schools for kids who may have allergies and may be prone to have a condition where they have a severe allergy attack. And so you have to sort of figure out, well, where is that thing going to be? Who's it help? How do I get it there? What kind of resources? And that may be, some of it may be, what rules do I have to set up from a policy perspective? And then how do I fund that to make a difference?
Right.
So each one of these, it's a slightly more complicated. How do you bring a product to market to get it to the community that needs it and can benefit?
One of the things we talked about was generational divide as a part of this equation.
Yeah.
How does that play in?
So this should be no surprise. The older you get, the more likely you're going to have a health issue.
I'm tracking.
Yeah, and so there's also, it's unlikely you're going to become a new person at some point in your life, but you're going to have to begin to adopt new opportunities to engage with the health system and pursue health behavior.
As a consumer.
Yeah. As a consumer. And so, in some cases, someone may be learning a new trick for their first digital appointment, or maybe experiencing an engagement that they, getting care in a place different than just going to their doctor's office.
Right.
And so, one of the things that as healthcare in particular becomes a more digitally transformed industry, making sure that our loved ones, our older loved ones, are sort of on the boat and understand how to have a virtual appointment and are able to have that kind of interface. And it's hard because the older I get, my hearing isn't really good, my vision may not be great. If you don't have access to digital tools, you're being left behind.
Yeah.
So there's a lot of different fundamental access issues that we need to think about when it comes to that. And for the, for people who are just sort of starting out in their careers and just getting out of college and being adults, or just, getting their own place to live, part of that is also helping them to understand the value of having a relationship with a healthcare provider.
Yeah.
Because they are, of course, empowered to believe everything and be in charge of their lives. And they're, less sick than they will be in an older life span. But that's a real hard thing, because healthcare is now, the last sector that's really becoming digitally connected and enabled. And when we rely on this kind of, it's a hybrid system, right? We're still going to see people in person, but we have to figure out how we make sure that we're fostering that positive relationship, no matter the format. And in some cases, it's going to be new approaches to care, and there's going to be a learning curve. We want to make sure that no one slips between the cracks.
Right.
Particularly if someone gets a more serious diagnosis and now has to, see a specialist here or a specialist there. I do some work on the topic of health equity, which means helping all communities have access to the same level of care and hopefully getting the same level of outcome, so that you don't have differences between people who may be more financially enabled or not, or maybe have been systemically excluded.
Right.
And I had the wonderful opportunity to meet one of the heads of a health program in Chicago where they train doctors, one of the largest in the city. And this leader told me about a gentleman who'd come into the emergency room for a situation that could have been handled in an outpatient setting.
Okay.
And it wasn't that person was ill-informed. That person didn't have the time or the time off from work to be able to go to a primary care doctor, then get a diagnostic, then go see a specialist, then get the results, then get a medicine, and all of that could happen in the emergency room. So what are we doing to help our health system meet
that
patients where they are?
Sure, yeah.
Right, and have some formats that may be new, that just make it a whole lot easier for people to get the care they need and deserve.
Yeah. So what are 2 or 3 things that healthcare providers, anybody watching this that sort of falls in the communities that you serve, should be thinking about?
Yeah.
What comes to mind there?
We talked a little bit about customer service.
Yeah.
The other is thinking about how you have I almost think of it as like an iceberg of information, right? We need to acknowledge that we've got attention span problems.
Right.
It's a chronic disease in this country. But we also need to figure out how to be compelling and engaging and resonate with our audiences when they need us. And then make sure that we have information that's accessible that goes down to a level of depth for those who want to dig deeper.
Right. But not trying to information and inundation, drink from the fire hose all at once.
Show me the above the waterline, and then for those who want to opt in for more, make sure that they can dive deep.
Right.
So I think it's a balancing act. And the other is make sure that you understand the mindset of your target audience. I mean, I'm going to go back to research a dozen times. But, for example, in patients who've had cancer for a long time, they may be near the end of life. Their doctor may have another choice, and there's been great innovation, so people may have more choices. It's sometimes important to help the patient express his or her or their wishes, so that then they can help their family members be comfortable with the journey that they're going on. So it's very situational, it's very personal. It involves someone's beliefs and then someone's own decisions.
I have to ask you this question. It's a little off topic. I always ask, what's one word or phrase that we should stop using at the workplace?
Pushback.
Pushback.
I
hate I'm going to push back on what
that is a bad idea. We're going to push back on that idea. We need to push back. And I'm like, oh no.
What is it about that really grinds your gears?
Well, because it's really confrontational as opposed to, I think, and this is the one thing I didn't say that I meant to. Our work as communicators, increasingly, we're strategic business advisors. I mean, I saw a job description for a mid-level person that is business communication strategic advisor.
Okay.
Right. So it is that advisory capacity means listening critically, helping to understand what the other person or the entity or the client's perspectives is, and figure out what that really means. Because pushback means I know what I'm talking about, and you can't be right. And I think we just need more dialogue. And pushback just feels so. I mean, find confrontation other places. Pushback is a lazy way of saying we need to do a better job of understanding the problem and presenting a solution that gets us where we need to go.
No, that's great. I was just in a sales marketing conference where there was like a sales thought leader that basically said the worst thing you could ever say is, I've got this. A different way of saying, I don't want to deal with this.
Right.
I've got it.
Right.
I know what to do.
And pushback is, you don't have it.
You don't have it. I've got it.
I was like, well, we got to push back on this. I'm like, oh, I can't.
Yeah. Okay, good to know.
Yeah.
Well, I'm going to push back on people saying push back.
That sounds like
it's a different way to use the pushback.
I think that's a way to build trust.
Okay. Yeah. Turns out that pushing back on things doesn't build very much trust. All right. Well, Lynn, thank you so much for joining me today. This has been a wonderful conversation.
It's been great. It's been great to talk to you. And thank you for helping me to sort of think about what I do so I can be a little bit cogent in presenting it.
Well, thanks so much, Lynn.
Thank you. Thank you for having me.
El Fango.